public health, focusing on epidemiology. Historical or history of all these studies made it a prospective discipline outlining historical trends that have developed epidemics in the community. And these studies began with the Greeks because their concern sans ancient epidemics and deadly disease toll of deadly and dangerous illnesses which were attributed not just because the human body but related causality with environmental factors. The explanation for this include events, right? Because supposedly it was an epidemics and all kinds of pandemics and all kinds of illness because of the wrath of the gods and bringing a breakdown of religious beliefs and morality. Also, it was found that the weather it was one of the reasons the human body had this kind of breakdowns. Body and environment related. Also, because the bad air later during late Renaissance, pioneers of statistics related biology work on the human body qualified and quantified morbidity and mortality trends, where John Snow's investigation of London cholera outbreaks were reported. William Farr promoting its viral statistics data, and during the 19th century, early microbiologists found the theory of germ and disease, which it was formalized, and then found out the specific organism which made the diseases. These stages are the genesis in these studies and is as follows. The environment is or becomes a factor and cause of disease. A deadly disease in which two sides wrote the ravages produced by the disease. where graphic descriptions of epidemics and history was shown early concern by the authors which were the cause of all this phenomena. Many people who were healthy and all in a second without reason were seized with violent hits in the head with redness, inflammation of eyes, in the throat internally, the tongue, where the blood quickly suffused and the breath became fetid, following a sneezing and hoarseness, where these disorders settle along with violent cough, following the chest, fastening down, moving the stomach, causing vomiting of bile, where physicians gave so many names, assessment, and pre-diagnosis, probably diagnosis of all many kinds of names. And it was said that they were caused by distress. And were reaching all these violent convulsions attacked most of the people who had all these symptoms. Some of them got all these symptoms right away, and for some other people, all these symptoms were developed long afterwards. Therefore, where the body externally cannot be touched and still looking so pale or too red, breaking out in pustules, ulcers, where the internal fever is intense, where the sufferers cannot bear to have on them. Even the fine and linen garment was obstructing their comfort, where they insisted to be naked, and where there was really nothing they were interested or longed for, right, than to perhaps throw themselves in a cold bath, and where the disease is in their hides, the body, right, don't wait much longer until desperate for their symptoms. They passed away on the 7th or 9th day of having all these issues in their bodies, regardless of their strength, regardless of everything. And where life cannot be longer supported, and if they survive the disease, move on to the bowels, where they become ulceration with diarrhea, and where by the time later stage cause exhaustion, where they eventually passed away. So that's the reason the preventive medicine and public health comes handy. We're not just the medical students, surgical technologists, nurses are responsible to learn, but as a way of culture for people to understand from the past, to bring prevention into their lives and learn how to do all the required things to keep moving in life in a healthy manner and safe, learning what it takes to keep their bodies as their blood type and all kinds of illness that are surrounding each one of the members of the family, as well relatives, perhaps neighbors, and that way people can promote health in the community by checking up with the health department in the measurements to keep their environments, their gardens, their walls, their floors, their roofs, applying the pesticides yearly, indoors and outdoors, and to keep up with the vaccines and vitamins, as well exercise and healthy nutrition. That's the reason this science came in hand during the medical doctor training, medicine doctor training. It requires the consideration of the quality of the waters, from the differences of the taste, the weight, and the differences in between a clean water and a dirty water or polluted water. The same way, when it goes to a city to which is strange or different, where people don't really live, comes in handy to get to know about all these things. All these situations are very important to consider when moving to another city to live or to work. The wind, the raising of the sun, the influence on the weather, the north or the south. These things are very interesting, and the concerns about it makes the inhabitants to fix or to remodel even their homes, because the sun is a very important rays to clean the environment inside of the house and outside of the house, whether if the soil, right, is soft, right, are elevated, rocky, salty, unfit for stepping up, where the ground, right, is deficient or not at all, right, where the water is available or not. All these things are very important, right, because if it's not suitable for living, it's just like the person is confined in a condition or a situation not able to provide a healthy living, right? And where their pursuits to saving money, to have a good job is going to be limited. And therefore, by tolerating environments, right, and by exercising and to intend to live in places that are not suitable for the type of people or the person you are, it can be very dangerous. The use of mortality counts the work and descriptive characteristics of birth and data and death data, including seasonal variation, infant mortality, the excess male over female difference in mortality. Brown's work made a fundamental contribution by discovering medical and social phenomena regularities. He is the first who employs quantitative methods to describe communities, vital statistics, and organizing all the data related mortality. And a mortality table has been referred as Columbus of statistics. Ground procedures have made the discovery of trends in births and deaths to specific causes. His conclusions were not out there, but his development in statistical methods was very important. We see, right, in the publishing in between the difference in between of births of males and females along with their dates. And making all these studies since 1628 through 1662, where 209,436 males and 190,474 females were dead during the time frame that I mentioned. Therefore, the difference means that males passed away a big amount different than females. Then they don't know whatever happened because checking the statistics during those years presented to be Christian Within the same time, only 139,782 males and 130,866 females were presented in those countries. Probably the rest of the people were immigrants. Home scared children which nobody really cared for to do the right thing with them. Which is a very important data due that when humans are not vaccinated, humans are not cared appropriately, they become contagious diseases or contagious of many kinds of illnesses, and therefore when these people walk along with others by being close to other people, they promote the epidemics around. The use of natural experiments. Snow was investigated cholera epidemic during the 19th century, the middle of 19th century. The work of these scientists provided the classic study linking cholera epidemic to contaminated water supplies. And these cases cause fatal attacks and deaths. This powerful observation and inference developed the hypothesis that contaminated water might be associated with outbreaks of cholera. And where these observations associated with the water from one of the two water supplies that serve those areas, where working out whether cities were able to fix things and promote the health required, and this way bringing the prevention, the health to the communities. In the 1849 to 1854 Lumber Company had a relocation of water source less contaminated, and where 1854 another epidemic of cholera occurred. And this area consisted in 2/3 of the country residents' population, and this company served those areas. Therefore, the water laid out in an interpreting manner, the houses were able to receive water from sources that were healthy. This other situation occurred in 1849, where the water were contaminated, and where eventually finding out and studying that the waters were the reason the cholera was developed, and bringing out the breakout of this illness, the water supplies were solved. So the SNOWS methodology maintaining all this information, it was the great source, this great observation, and uh, the quality of their approach found out until the present day that epidemics are able to control, and therefore that's how the studies in the community becomes handy to uh, provide clinical assistance in regards to the people with different needs, especially in obstetrics hospitals, right, where the women were dying and the children also from puerperal fever. Uh, Therefore, the different steps for practicing medicine also was very well settled in regards and how to promote and prevent medical casualties and help the health, the public health, by training the students into better ways to provide their care to avoid, right, the transmission of infection, and practicing the hand washing, especially in chlorinated solutions during those times, right? And also where the death rate for puerperal fever dropped due the training for care into these communities. A contemporary of John Snow, it was William Farr in 1839, which assumed the post of compiler of abstracts. And the contribution to public health and epidemiology are the development of sophisticated system for qualifying medical condition, providing foundation for the international statistics classification of disease, which is in use up to this time. This is some sort like a census data to study occupational mortality. In addition, different things were explored, which were the linkage between mortality rate and population density, where the average number of deaths and births per 1,000 living persons were rising with the population density, which means the number of persons per square mile. And therefore, as the excess of births over deaths, except the most crowded areas, tend to increase in less crowded areas. The deaths with high mortality districts and the mortality rate per 1,000 greater than square than experienced in healthier districts, where because the pollution created by all the people the impurity of water, pernicious thirsts, floating dust, cyanotic, contagious, and crowding in lodgings. So, compared to a healthier district which had salubrious soil, supplying the inhabitants with water generally free from organic impurities. The identification of specific agents of disease. In the 1800s, Koch, with the concept that diseases are caused by specific living organisms, where the studies or etiology, the tuberculosis, was published in 1882. This information was possible classifying disease by specific causal organism, and they were grouping anteriorly because diseases were studied and classified to that the epidemiologic studies. So King Upper 33 noted that Koch postulates were formulated as follows. He said the microorganisms must be observed in every single case of the disease that each person has. That it has to be isolated and grown in pure culture, and that the pure culture must, when inoculated in a susceptible animal, reproduce the disease, and that the microorganism must be observed in and recover from the experimental diseased animal. This was revised by King, right? Koch accomplished demonstration for the first time in the human disease the strict relation into microorganisms and disease. They were sharing something in common, the disease and the microorganism. Specifying the reason of disease and the organism which caused it provides a defined criteria to identify the disease rather than vague standards Koch's predecessors and contemporaries were having a hard time using. This brought and increased the awareness of the microbial agents' roles which cause human illness. The disease which is caused by the germs which became a germ theory of disease reached out the interest of public health community, and with the intention to limit the spread of infectious disease, using of cartoons published in popular media. Other significant historical developments: Alexander Langmuir, Wayne Hampton, Frost, Joseph Goldberg, Langmuir. They are called the fathers of infectious disease epidemiologists, and establishing in 1949 the section of the federal agency called Center for Disease Control and Prevention. This later came to be known as the Epidemiologic Intelligence Service, celebrating the 15th anniversary in 2001. Frost, Professorship of Epidemiology, using the quantitative methods to break up the public health problems. This concept tends to be restricted narrowly to the study of infectious disease. Goldberg, which discovered the cure for pellagra, nutritional deficiency disease caused by the 3Ds, dermatitis, diarrhea, and dementia, allow reduction of this occurrence of disease. Recent applications of epidemiology. This activity has practiced on the several decades. Framingham Hart study started in 1949 and pioneer of research investigation of risk factor for coronary heart disease. After the World War II, research associated smoking and lung cancer. The work of Dole and Peto. The computer and statistical software aided the proliferation of epidemiology research studies and the popular interest for epidemiology findings. The diverse health concerns of the immune deficiency syndrome, and where chemical spills, breast cancer screening, the health effect of secondhand cigarette smoke, are reporting triumphs in findings epidemics, and where epidemiologists identify risk factors of cancer, heart disease, infectious diseases, and many other conditions. The infectious disease in the community is one of the most familiar types of epidemiology occurring investigates the occurrence of epidemics of infectious communicable disease caused by bacteria, viruses, microbiologic agents, where finding out causing and cause of foodborne illnesses and investigating still much more to come. New diseases such as SARS, which have an infectious origins. The epidemiologic methods now are illustrated, and with this, with the intention to eradicate as much as possible, such as polio, measles, smallpox, and other communicable diseases, and other is the outbreak of infectious diseases in hospital, nosocomial infections, and the role of epidemiologic intelligence service investigating all these outbreaks. Health and the environment. The exposure to air pollution, contaminated drinking water, accidental injuries, and other environmental agents affects the human body. The environmental epidemiology address the occurrence, the distribution of conditions such as dust diseases, dermatosis, which are occupational dermatosis, and other diseases that link harmful physical waste of energy, ionizing radiation from X-ray machines, etc. Many illnesses studied by environmental epidemiologists have aging factors and manifestation right similar to those of occupational epidemiology, such as pesticides causing environmental associated illness, injury control, epidemiology studies, risk factors associated with motor vehicle accidents, bicycle injuries, trauma, and evaluation of seatbelt use. Studies are the result of analysis and examinations of all these things that happen to the community, and their prevention suggests measurements and modification of the environment, especially in the reproductive and perinatal epidemiologies investigating the environmental and occupational exposures and reproduction. The health outcomes related to the infant death syndrome, epidemiology of neonatal brain hemorrhage, early pregnancy, and methodologic issues in drug epidemiology. The chronic disease, the life and health promotions. For example, a topic of role of exercise, diet, smoking, and alcohol consumption, which is the reason of different kinds of outcomes in the physical health. The excesses provoking the coronary heart disease, the arthritis, diabetes, cancer, bringing the hypothesis of the risk factor, which is studying to include all the antecedent variables within the environment of the person, including the psychosocial, which might be associated with the health and disease. Bringing up the interest doctors to the community where the studies are done, how the stress and the risk factor for hypertension, ulcers, colitis, heart disease, and cancer can be together, right, or reasons of people involving epidemiologic factors of disease, including the personality, and where the type A personality and its potential risk to heart disease can bring, right? 1, 2, 3.